Hello guys, thanks for watching my videos, and today we're going to learn about what is deductible, copay and co-insurance. So what is deductible? Patient need to meet the deductible amount for covered healthcare service before your insurance plan start to pay. With a $2,000 deductible, for example, you pay the first $2,000 of covered service yourself. After you pay your deductible, you will usually pay only a copayment or co-insurance for covered service. So here the patient has to meet the deductible to start the insurance coverage. So unless patient meet the deductible, the insurance company will not start paying for the claims. So we can see a few examples today. Okay, here so we have two types of examples. Okay, first patient visiting on first visit, and the bill amount is $3,000 and the allowed amount is $2,000, and the patient has deductible of $2,000. So for the first visit, the overall allowed amount for this treatment is $2,000. So patient has paid $2,000. So there is no paid amount. There is no payment from the insurance company since patient has $2,000 of deductible. For the same patient, for the same kind of service, and he is visiting the doctor for second visit. So since the patient met the deductible of $2,000, and for second visit, when the bill amount is $3,000 and the allowed amount is $2,000, here insurance company is going to pay $2,000. So there would be a no deductible unless if any patient has any copay or co-insurance. The insurance company will pay excluding that amount. So here, so we have mentioned the billed amount is $3,000 and the adjustment is $1,000. The overall allowed amount is $2,000, and the patient has already paid the deductible. I mean, the patient already met the deductible, and the insurance company paid $2,000. Okay, I hope you understand. If you have any questions, please drop your questions in the comment box. All right, and let's move on to copay. A copay is a fixed amount you pay for a healthcare service covered by your insurance. It is typically due before we provide service. Copay are different for different service. In the same plan, you may pay a different copay for your primary care than for the specialist care. Emergency care copay are also higher than other copay amount. How copay works? Copay vary depending upon the types of service that you receive. For example, a visit to your primary care physician may have a $20 copay, specialist care $50, and whereas an emergency room visit may have $100. Here, the copay is a fixed amount by the insurance company. So whenever the patient opt for any types of plan, there will be a copay or co-insurance. So the insurance company will fix the copay for the primary physician as well as the specialist, and even for the emergency service. Depends upon the plan, the insurance plan, the copay may vary, and also it varies from specialist to specialist. For a physician, mostly it will be lower than the specialist care. So we can see few examples here. Okay, so this is a copay calculation, and the first calculation is for physician care and the second one is specialist care. So the first calculation, the bill amount is $500 and the contractual adjustment $150. So allowed amount is $350. Okay, and here the patient has deductible of $100 and copay is $20, and as per the allowed amount, deducting deductible and co-insurance, remaining is $230, and that is what the insurance company is going to pay. When it comes to the specialist care, and same bill amount $500, adjustment is $150 and the allowed amount is $350, and the patient responsibility is here deductible is $100 and the specialist copay is $50. So our overall allowed amount is $350 and the deductible is $100 and the specialist copay is $50. When you minus $150, the remaining is paid by the insurance company, that is $200. So hope you know that what is the difference between the primary care physician copay and specialist care physician copay. Alright, so let's move on to the co-insurance. So what is co-insurance? Co-insurance is a amount generally expressed or fixed percentage an insured must pay against a claim after the deductible is satisfied. In health insurance, a co-insurance provision is similar to the co-payment provisions, except copays require the insured to pay at the set dollar amount at the time of service. Some property insurance policies contain co-insurance provisions. Okay, here the co-insurance is generally fixed by the insurance company, and this is like more similar like a co-payment, but however co-payment the patient has to pay at the point of service, but in co-insurance the patient do not want to pay anything in the at the point of service. When the claim process, then whatever the remaining percentage that patient has to pay. In case if patient has any secondary insurance, then the secondary insurance will cover the remaining balance. Mostly for Medicare it's 80-20. 80% will be covered by the Medicare and 20% is a patient responsibility. In case if patient has any secondary insurance, the remaining 20% will be covered by the secondary insurance. So how co-insurance works? So one of the most common co-insurance breakdown is the 80-20. Under the terms of 80-20 co-insurance plan, the insured is responsible for 20% of the medical cost, while the insurers pay the remaining 80%. However, these terms only apply after the insured has reached the terms out-of-pocket deductible amounts. So mostly when it comes to co-insurance, patient must be having the deductible. So whatever copay or co, whatever it is, once patient made the deductible amount, then the copay and co-insurance will start from the insurance copay or co-insurance will start. Okay, so here we'll see few examples for co-insurance. Okay, so first one is for the Medicare co-insurance. So as per Medicare contract, 80% will be covered by the Medicare. So here the bill amount is $300 and adjustment $80. So allowed amount is $220. So out of $220, 80% is $176. That's what insurance company paid here. The remaining $44 is a 20% of the co-insurance. So this is the patient responsibilities. In case if patient has any secondary insurance, and the secondary insurance will cover the 20%, otherwise patient has to pay this amount. Okay, there's a second example, and here so we have the co-insurance 60-40, and here the same bill amount $300, adjustment $80, allowed amount is of $220. Here there is no deductible and copay. So however, the 60% of the paid amount is $132, which is paid by the insurance company, and the $40 is $88. So here in case if patient has any secondary insurance, and the insurance company will cover this remaining 40%, otherwise patient has to pay. Alright, and that's it now. So if you have any questions, please drop your questions in the comment box. I'm happy to respond. Thank you.